Hi Margaret.
Hi, Regine.
As you know, I'm Regine, your fellow student nurse, and for today, I will be sharing with you my knowledge about pathogenic diseases. What I will be discussing for today are the diseases itself, namely the tuberculosis, syphilis, cholera, meningococcal disease, specifically the bacterial meningitis, tetanus, its causative agent, the transmission, its clinical presentation, and lastly, its nursing intervention or treatments. Okay, so now Marga, when you're ready, I will start my discussion.
Okay, I'm ready now,
Is it
Regine.
okay with you?
Yes, go ahead.
Okay, so I will begin with tuberculosis. Tuberculosis is an infectious illness that mostly affects the lungs but can also affect other regions of the body. As a result, there are two TB-related conditions, the latent tuberculosis infections and the tuberculosis illness stage, or also known as the active TB. Tuberculosis is a worldwide public health problem that is closely associated with poverty, malnutrition, overcrowding, substandard housing, and inadequate healthcare. According to the World Health Organization, an estimated of 1.6 million deaths resulted from TB in 2005 itself. TB illness can be lethal if not treated appropriately. Mycobacterium tuberculosis is the bacteria that causes tuberculosis illness. It is an acid-fast aerobic rod that grows slowly and is sensitive to heat and ultraviolet light. TB bacteria are most commonly found in the lungs, although they can also be found in the kidneys, spine, and brain. Although it is contagious, not everyone who is infected with the said bacteria becomes ill. Mycobacterium tuberculosis is spread via the air as droplet nuclei, which are discharged when people with pulmonary or laryngeal tuberculosis cough, sneeze, yell, or even sing. Air currents can carry the infected particles throughout the room or structure. People who breathe in air with contamination of the tuberculosis germs can get sick, which is known as latent tuberculosis infection. Immunocompromised status like those with HIV, cancer, or transplanted organs increases the risk of acquiring the tuberculosis. With regards to its clinical presentation, remember that I have mentioned earlier that there are two types of tuberculosis, the latent and the active one. Latent TB doesn't have symptoms. A skin or blood test can tell if you have it. However, the signs of active TB disease include a cough that lasts more than 3 weeks, chest pain, coughing up blood or sputum, which is the phlegm from deep inside the lungs, feeling tired all the time, night sweats, chills, fever, loss of appetite, and even weight loss. The treatment for tuberculosis will be determined by the nature of one's infections. Regardless if it is latent or active, a physician usually prescribe antibiotic that should be taken within a span of time. And for us student nurse, we should be advocating to prevent the spread of tuberculosis infection through educating important hygienic measures. We should also wear PPE when interacting with TB patients. We should also ensure healthy lifestyle and adequate nutrition to improve the immune system, to promote the airway clearance, and administer medications as per physician's order, and monitor if there are any adverse effects. Now, Marga, do you have any questions with regards to the tuberculosis?
None at the moment naman.
None? Okay, thank you. Now, I will proceed with the syphilis. Syphilis is a sexually transmitted illness that, if left untreated, can lead to major health consequences. The infection progresses in phases, which are the primary, secondary, latent, and tertiary. Each stage has its own set of indications and symptoms. Treponema pallidum is a spirochete bacterium with several subspecies Begel, also known as endemic syphilis. It can occur in, on, or around the penis, vagina, anus, rectum, and lips or mouth. Syphilis can be transmitted through sexual activity and touch with an infected person's source. Minor wounds or abrasions in the skin or mucous membranes allow germs to enter the body. Also, during pregnancy or childbirth, babies born to syphilis-infected mothers can get the disease through the placenta or at the delivery. Using the same toilet, bathtub, clothes, or dining utensils as well as doorknobs, swimming pools, or hot tubs will not spread syphilis. Syphilis does not recur after it has been treated, and you can, however, reinfect if you yourself come into touch with someone's syphilis sore. Again, it is only transmitted if there is any entry or wound. So, syphilis manifests itself in phases, with different symptoms at each stage. The phases, however, might overlap and symptoms may not necessarily appear in the same sequence. You might be infected with syphilis for years without experiencing any signs. However, there is a common denominator with regards to each stage, which is called the chancre, or most commonly known as sore. Others might include skin rash, warty ulcers in mouth or genital region, hair loss, muscular pain, fever, and large lymph nodes. And as what I have said earlier, for infants with syphilis-infected mothers, there can be deafness, tooth abnormalities, and saddle nose for infants, as shown in the picture. For us student nurses, we should be educating about the importance of abstinence and safe sex. Awareness in recreational drug or substance use that can impair judgment is a must too. And we should be administering medications as per physician's order or monitor any adverse effects. However, for the patients, call a physician immediately for any odd discharge or source present. The source is also known as chancre, as what I have said earlier. And now I will proceed with the third disease, which is cholera, a bacterial infection spread by drinking polluted water. It causes dehydration and severe diarrhea, and if left untreated, can kill a person within hours, even if they were previously healthy. So, cholera is caused by a Vibrio cholerae, a species of gram-negative facultative anaerobe and comma-shaped bacteria, which naturally lives in brackish or salt water where they attach themselves easily to the chitin-containing shells of crabs, shrimps, and other shellfish. The disease's devastating consequences are caused by a toxin produced by the bacteria in our small intestine. So the disease is spread through the fecal-oral route. It is by eating or drinking food or water that has been contaminated by an infected person's feces or poop. So as shown in the picture, the disease is most commonly found in areas with poor sanitation with its water treatment. So the signs and symptoms includes profuse watery diarrhea, sometimes described as rice water stools, vomiting, thirst, leg cramps, restlessness, or irritability. Healthcare professionals should be alert if there are any rapid heart rate, loss of skin elasticity, dry mucous membranes, and low blood pressure. Getting vaccinated against cholera, especially when traveling where there is a cholera epidemic outbreak, is a must. Proper hand hygiene technique. Drink clean and safe water only. If at all possible, eat food that is fully cooked. Do not defecate in any body of water. Instead, use latrines. Proper disinfection of kitchen or food preparation area, and if infected, hydration is necessary. So, Margar is still there. So far, there are no questions naman.
Wala.
Okay. I will be tackling the fourth one, which is the meningococcal disease, specifically bacterial meningitis. It is a condition in which the fluid and membranes, or the meninges that surround the brain and spinal cord, become inflamed. Some persons who contract the infection die and some do recover. However, those who do recover may suffer from long-term effects such as brain damage, hearing loss, and learning difficulties. So it is caused by a gram-negative bacterium Neisseria meningitidis. It generally causes an upper respiratory infection, but when it enters the circulation or bloodstream, can cause meningococcal meningitis. So by exchanging lung and throat secretions, human can transfer meningococcal bacteria to others by saliva or spit. Close coughing or kissing, for example, or prolonged contact is usually required to transfer these pathogens. So clinical manifestations includes meningitis rash, altered mental status, nausea and vomiting, sensitivity to light, irritability, headache, fever, chills, stiff neck, purple areas of skin that resemble bruises, sleepiness, and lethargy. So for the interventions and treatment, meningococcal vaccination is a must. Immediate hospitalization when infected. Only drink clean and safe water. Get adequate amounts of rest. Do not smoke. Avoid contact with sick people and wash your hands often, especially if you work in a daycare or healthcare setting. So Marga, so far ba, do you have any questions or clarification with regards to the discussions I have done?
Wala kasi clear naman lahat.
None so far. Okay, we have come to an end, and lastly, it is tetanus, a dangerous nerve system infection caused by a toxin-producing bacteria. Lockjaw is a frequent name for tetanus. Its consequences that are severe can be fatal and have no known treatment. So it is caused by Clostridium tetani, an obligatory anaerobic bacillus, which has spores that can be found in dirt, dust, and manure, among other places. When these spores enter the body, they turn into bacteria, and it's effectively turned off until it can find a new home. It is transmitted when the spores enter the body through damaged skin, which is mainly caused by contact with infected objects. People's misconception about tetanus is that it can only be contracted through rusty nail or metals. However, it is present in dirt, soil, and even manure. It just so happened that when one stepped on a nail, there is an instant entry to the body through lesion, thus acquiring the disease quicker. Common clinical presentation is the jaw cramping or the lockjaw, sudden involuntary muscle tightening, painful muscle stiffness all over the body, trouble swallowing, jerking or staring, headache, fever and sweating, and changes in blood pressure and heart rate. As it becomes worse, healthcare providers should be notified with laryngeal spasm or involuntary tightening of the vocal cords, broken bones, infections gotten by a patient during hospital visit, blockage of the main artery of the lung, or pulmonary embolism, pneumonia, and breathing and difficulty in breathing. So the easiest way to avoid tetanus is to have your tetanus immunization up to date. Vaccine protection, like immunity from a previous virus, does not last a lifetime. This implies that even if you have already had tetanus or had the vaccination, you must continue to receive the vaccine on a regular basis to maintain a high degree of protection against this fatal and dangerous disease. Tetanus immunizations are recommended for people of all ages with booster injections throughout their lives according to the CDC. Proper wound care following the standard precaution measures, and wash hands often, especially if contracted with dirt, soil, and dust. It is also important to seek doctor immediately when any of the signs and symptoms occur, as I have said, it is fatal and dangerous. So Marga, that ends my discussion.
Hi, Regine.
Are there any questions or clarifications?
Wala kasi super clear lahat.
Okay, that sums up the 5 pathogenic diseases that I have discussed, and I hope you learned something and vice versa. If there are any questions that you would like to ask, I am free to answer all of it. And these are my references.
Okay,
Thank you for
Regine.
lending me your
Thank you.
time and have a great day.
So, hi Regine. So, it's my turn naman to teach you my 5 chosen pathogenic diseases. So, here is the points of discussion or the flow of the discussion. First and foremost is the gonorrhea. Second, the salmonellosis. Third, the diphtheria. Fourth, candidiasis. And lastly, the thalaromycosis. So, now proceeding with the gonorrhea. So, for the description, actually, gonorrhea is a sexually transmitted bacterial infection that affects both males and females. So, it can infect the genitals, the rectum, and the throat. Also, it is relatively frequent, especially among the young people, which is ages between the 15 and 24. So, the causative agent of the gonorrhea is the Neisseria gonorrhoeae, which causes gonorrhea. And again, it is an STD or sexually transmitted illness. So the gonorrhea bacteria infects the reproductive tract's mucous membrane, including the cervix, uterus, and fallopian tubes in women, and also it can infect the urethra in both men and women. So as per the transmission, again, as I stated earlier, it is an STD in which gonorrhea is easily transmitted during sexual activity and is highly contagious. So when bacteria enter your body through the penis, anus, vagina, or mouth, commonly during unprotected sex, you might become infected with the said disease. So as per the clinical presentation, it can lead to eye infection, some rashes, and also a patient can feel pain or burning during urination. And also, discharges can also be seen. Urethral infection in men includes dysuria or white, yellow, or green urethral discharge. Also, there is a greater frequency or urgency of urination. And for male as well, there can be a testicular swelling or pain. And most women with gonorrhea are asymptomatic. So as per the nursing intervention or the treatment of this disease, so to treat gonorrhea in adults, prescribed antibiotics are used. And also, in order to prevent the said disease, practicing safe sex by using condoms and limiting the number of sexual partners are also good prevention of the said infection. So, okay ka po ba?
Okay pa naman,
Sige. So, next now is the salmonellosis. So, salmonella infection is a bacterial illness that affects the intestines. So, it is also a foodborne disease, which are diseases caused by substances that enter the body by the intake of food and are usually infectious or either poisonous in nature. So, as per the causative agent, here, salmonella infection is caused by salmonella bacteria, which are type of salmonella bacterium. So animals, most especially the birds, carry salmonella in their intestines. So as per the transmission, salmonellosis, humans are frequently infected with salmonella by consuming meals contaminated with animal excrement. So if people who come into direct contact with some animals, such as chickens, like I said earlier, birds, and even reptiles, and they do not wash their hands properly before handling food, so bacteria from the said animals can spread to the food. So as per the clinical presentation or manifestation, it can be presented the following. So diarrhea, abdominal pain, cramps, fever, and also in severe cases, there can be high fever, there can be aches, headaches, lethargy, rash, blood in the urine or stool, and in some cases, salmonellosis may become fatal. So, in terms of intervention and treatment, so to prevent salmonellosis, an individual must adhere to the 4 rules of food safety recommended by the CDC, which are the clean, the separate, the cook, and the chill. So we must also wash our hands always thoroughly after using restroom, changing diapers, or any types of activities. As well as, again, after coming into touch or direct contact with animals. So if one has a salmonellosis, so to replenish the fluid loss due to diarrhea, the person should consume enough of fluids throughout the sickness. So a person with severe diarrhea or has been unwell for more than a week may need to be admitted to the hospital. He or she will be given IV fluids at the hospital. So now, third one is the diphtheria. So as per its description, diphtheria is a dangerous bacterial infection that mainly affects the nose and the throat mucous membranes. So people who live in overcrowding or filthy conditions, people who are malnourished, and children and adults who are not up to date on their immunizations are all at risk of this disease. So for the causative agent, diphtheria is a dangerous infection caused by the bacteria called Corynebacterium diphtheriae, which produce the toxic diphtheria, or we can call it a poison. And it is also known as the Klebsiella bacillus after the German bacteriologists Edwin Klebs and Friedrich Loeffler, which discovered it in 1884. So as per the transmission of the diphtheria, Diphtheria is spread from person to person through direct contact with an infected individual's discharge from the eyes, from the nose, from the throat, or even the skin. So diphtheria bacteria are also transmitted from person to person through respiratory droplets, such as produced by coughing or even sneezing. So also, touching infected open sores or ulcers can potentially get people sick. So as per the clinical manifestations, these are the following: mild fever, sore throat, club-looking bacteria as we can see here in the picture, difficulty swallowing, loss of appetite. There can also be hoarseness if the larynx is involved in the cell disease. Also, a patient can feel or experience difficulty in breathing or rapid breathing, and also a patient can also experience chills. So as per the intervention or the treatment, so the greatest method to avoid diphtheria is to stay up to date on recommended immunizations. So close contacts of someone who has diphtheria should be treated with antibiotics according to the CDC. So this is referred to as the prophylaxis by experts. So if a doctor detects diphtheria on a patient, he or she will be prescribed a drug that neutralizes the toxin in the body. So antibiotics such as penicillin, erythromycin help the body kill microorganisms and clear diseases. So yan, tapos na tayo sa pangatlong disease. So okay pa ba? Nakakahabol pa?
So, nakakahabol pa naman,
Okay.
sis.
Basta Regine, sabihan mo lang ako kapag may mga questions ka or may mga information kang gustong i-input. Okay? Sige, thank you. So now, proceeding with the fourth one, the candidiasis. So as per description, candidiasis is an infection caused by the candida yeast, which is a type of fungus. So there are actually different types of candidiasis, such as mouth, throat, esophagus, and even vaginal candidiasis. So as per the causative agent, candidiasis is a fungus caused by numerous kinds of candida yeast, including the candida albicans. So Candida albicans is the most common cause of candidiasis, accounting for more than 70% of all candida infections, according to the CDC. So as per the transmission, Candida albicans is spread through contact with contaminated individuals or objects, either directly or indirectly. So Candida becomes a pathogen when the patient's immune system is compromised as a result of surgery or chemotherapy, or even as a result of a disease. So as per the clinical manifestations, for the candidiasis in the mouth or the throat, there can be white patches on the inner cheeks or the tongue of the patient, here as we can see here in the picture attached. Also, there can be white patches on the roof of the mouth and the throat of the patient. Also, there can be soreness, redness, and in the mouth, there can be a cotton-like feeling. Also, a patient can experience loss of taste, also pain while eating or swallowing food, and also on the corners of the mouth, a patient can experience cracking or redness. So in terms of the vaginal candidiasis, here in the picture, so there can be a redness and swelling of the vulva. There can be vaginal pain and soreness. Vaginal rash can also appear. In terms of the discharge, thick, white, odor-free vaginal discharge with a cottage cheese appearance can also be experienced by a patient diagnosed with candidiasis. So now, in terms of intervention and treatment, so among the methods for preventing candidiasis in the mouth and throat are the following: maintaining good oral health, rinsing of mouth or brushing teeth after using inhaled corticosteroids, and flossing daily. So now, among the methods for preventing candidiasis in the vagina are wearing cotton underwear, avoiding hot baths, avoiding douching, and changing tampons and pads when on period. So now, finally, for the last disease is the tularomycosis. So as per the definition, tularomycosis, or also known before as the penicilliosis, is a fungal infection that occurs in immunocompromised people. So people who inhabit or visit Southeast Asia, Southern China, or Eastern India are only affected by tularomycosis or can be infected or affected by tularomycosis. So the causative agent, so Thalaromycosis is a fungal disease infected caused by Thalaromyces marnificae. So infection with Thalaromyces marnificae is more common in those with weaker immune systems such as HIV patients. And as per the transmission, the fungus that causes Thalaromycosis is transferred in terms of humans by inhaling spores from the soil. Through the hematogenous route, it travels from the reticuloendothelial system, the skin, and other organ systems. So as per the clinical manifestation, so in patients with advanced HIV illness, a disseminated infection affecting several organ systems is the most common symptom of Thalaromycosis symptom. Also, there can be skin bumps here and lesions. As you can see here in the picture, there are skin bumps right here, there are lesions right here, and also patient can experience fever, weight loss, cough, difficulty in breathing, and also patient with Thalaromycosis can experience swollen lymph nodes. So in terms of now for the intervention and treatment, so Thalaromycosis requires the use of antifungal medication, which is medically prescribed. So the most typical treatment is amoxicillin B, which is administered intravenously for 2 weeks before being followed by itraconazole, which is administered orally for 10 weeks. So that is it for my presentation or my peer teaching part, Regine. So are there any questions?
So far, wala naman akong questions.
Okay, wala naman. Okay, sana marami ka ding natutunan dito. So mamaya to test kung may natutunan pa talaga or may nadagdagan sa knowledge, magkakaroon tayo ng quizzes. Okay? Okay, thank you for listening, Regine.
Meg, thank you for that well-explained discussion.
So, ngayon naman, since done na ako mag-discuss, magkakaroon na tayo ng quizzes, yung sasagutan mo, para mag-test lang ng knowledge if ano yung natutunan or na-retain. Okay lang ba?
Okay, sige, sure.
Wait, chat ko na lang sa chat box yung link. Yan, nasan ko na.
Okay, sige, open ko. Tapos share screen ko na lang para nakikita natin yung progress ko habang nag-quiz.
Okay, sige.
Okay, start ko na ha. Ayun, okay na. Na-perfect naman. Ayun yung results.
Congrats! Galing.
Okay, sige. So, ayun, di ba tapos na din ako mag-present. Ngayon, isi-send ko naman yung quizzes para matest ko din yung knowledge mo about dun sa pre-set ko. Okay? Ayan, nasend ko na sa chat box. Share screen mo na lang din.
Okay, wait lang. Kita ba?
Ayan, kita na.
Okay, sige, mag-start na ako.
Start mo na lang. Ayan, good luck. Ayan, okay na.
Natutunan naman so far.
Okay naman, no, yung peer teaching natin. Kasi clear naman, tsaka basic informations lang mostly yung pinresent natin pareho. So, ayun lang. Thank you. Sana marami tayo pareho natutunan. Sana magamit natin.
Thank you.
Okay, ayun lang. Salamat.
Bye.
Bye.